Anyway, traumatic brain injury, hormone dysfunctional syndrome. When I started in the area of anti-aging medicine, I really had a difficult time with the terminology anti-aging medicine because there's no medical terminology or appropriate ICD-9 code, CPT code that goes along with anti-aging medicine. So when I stumbled about 6 years ago onto the beginning of my epiphany in the area of a traumatic brain injury leading to head trauma, it gave me an opportunity to state that the process of hormone replacement had a valid underlying reason other than for vanity medicine as it had been started back in 1993. So this provides us with a very evidence-based rationale for why we can go ahead and start replacing hormones. Prologue. We are finding that, or we already know that with every area of the brain there's an associated group of symptoms or a deficit in functioning, from the frontal lobe to the parietal lobe. The things that are highlighted in blue are relative to what I see most commonly in people with traumatic brain injury. Occipital lobe, temporal lobe, these things you all remember. Cerebellum. Anyway, different areas of the brain, what we're finding is that every area has influence with every one of the hormones. Testosterone and growth hormone work with the hippocampus for memory recall and the ability to learn new things. Testosterone obviously in the libido center of the brain, the limbic center of the brain. Also with depression, with dopamine. There's such an incredible interaction between vitamin D, thyroid, growth hormone, melatonin, dopamine, and the occurrence of our mental state and the effect on the limbic system. Dihydrotestosterone. Interesting that the finasteride and durastride that we use, that it penetrates into the brain and interrupts the conversion of free testosterone to dihydrotestosterone. Dihydrotestosterone is responsible for sense of well-being, aplomb, confidence, its antidepressant effect, anti-anxiety effect. And we're forgetting that some of the medications that we use can actually create a great problem. There was an article a couple of weeks ago talking about finasteride and durastride creating cardiovascular problems. That's because it interrupts the conversion of testosterone to dihydrotestosterone in the heart, and it helps with inotropism. Estrogen, extremely important in the central and the brain. Estrogen increases the amount of nitric oxide, so cerebral blood flow increases. Estrogen also helps with the production of growth hormone. Peripherally, estrogen has been found to diminish the receptibility to growth hormone, but it's minor. Pregnenolone, incredible product. Pregnenolone is referred to as the mother of all hormones. Cholesterol obviously is the father, and all the other ones are the children. So if we interrupt the conversion of cholesterol, the presence of cholesterol in our body, we start losing all these hormones, pregnenolone being the first one. The benefit of pregnenolone is it converts to allopregnenolone, which is protective of the brain. And pregnenolone becomes progesterone, which is alloprogesterone, which is also protective of the brain. Recently, there was the article about people with in coma, getting IV progesterone, and they get better faster. They awake faster, or they awaken faster. It's because the progesterone going to alloprogesterone. But if they also started with pregnenolone, they'd have the benefit of allopregnenolone. Epidemiology, well, there's an estimated 1.9 million people a year who end up having a head trauma. 52 to 53,000 of them die on the spot. There's some 300,000, 360,000 people who end up in the emergency room, ended up hospitalized. And there's a million whatever who stand up, brush themselves off, not knowing that they have a smoldering process in their mind or process going on. And subsequent, they're additive. Subsequent injuries can lead to eventually a threshold where they precipitate the hormone deficiency. Falls, MBAs, and the majority of falls are in people that are 65 years of age and older on multi-pharmacopoeia. Most traumatic brain injury and behavior, this is brain injury and depression. Traumatic brain injury results from auto accidents is what we usually see, or falls, but what we're seeing a lot more of now are all the vets that are coming back from Afghanistan and Iran, where they're being, or Iraq, they're being stated that they have post-traumatic stress syndrome. Well, probably most of those post-traumatic stress syndromes are due to blast injury. This is a new area within medical physics where they're looking at the impact of shock waves. They actually have 5 patterns of the shock waves that lead to internal trauma to the brain. You don't need to have a penetrating injury, bullet to the head, shrapnel to the head, to precipitate this process. And there's 45 to 90,000 vets with symptoms that are persistent, and they warrant special care. There's Fort Collins, back east, Fort Collins with Dr. Tweely, who's head up this program, where he puts them in front of Wii, and they use Wii as a means of tactile visual stimulation of the brain, and they never go further to look at the hormonal deficiencies. Neurochemistry and anatomy changes contribute to post-traumatic brain injury. There's a mechanical impact on the brain, and then there's a biochemical damage that happens that precipitates damage to the regulatory mechanisms in the brain dealing with hormone production and release. Motor vehicle accidents, boxing, martial arts, that's why punch-drunk, martial arts, the extreme, what's the other one called? Crazy one. Slip and fall, blunt trauma, shaken baby syndrome can destroy not only the pituitary, but can also lead to hypothalamic damage with reduction in the regulatory mechanism. Sudden drop and sudden stop, you go to the amusement parks, Magic Mountain has that ride called Batman. You go up 200 feet and you drop down to 10 inches from the ground. It's that sudden stop that pulls the stalk of the pituitary and can lead to damage to production of hormones. Intracranial bleeding, like hemorrhage, so someone can have either a ischemic infarct or a hemorrhagic infarct, and that can lead or precipitate the biochemical process leading to interruption of the regulatory mechanism for production of anterior hormones or anterior pituitary hormones. Blast trauma, IEDs, gunfire. Just repetitive gunfire, or when they're in training, they're throwing a flash bang, either in the LAPD or in the military, or throwing grenades. That impact of that explosion can lead to head trauma. Boxing as a sport, this was my epiphany article. I was doing a project on neuroendocrinology, the pathophysiology, looking at what we knew, and this is in 2004-05, what we knew relative to where in the brain the hormones affected and how they affected us in different areas of the brain. Like a study that was done at UCLA where they had donations of brains and they were looking at estrogen receptors. Those of you who remember, I think it's Brokaw area number 52, which is a speech center. When they were going through male and female brains, obviously they found in the female brains there was an incredible intensity of estradiol receptors in the speech area. Thank you. Not always do you get it. Watch it. I have 3 daughters. I get it all the time, please. Pathophysiology, this is the short version. This is an incredible area that is now being unfolded. This is a short area. Biomarkers of proteolytic damage. It turns out that there's a very, very unique group of chemicals in the brain called cap space. Calpain is a group of some minor ones also, that are the apoptotic or the messengers of death in the brain. They are only initiated with head trauma and only in the brain. And there are 4 areas that these chemicals seem to be most concentrated, and therefore the areas that they create their damage. Cortex, cerebellum, thalamus, and the hypothalamus with the hippocampus. So when all of us walk into a dark room and flip on the light switch, and the light doesn't go on, what's broken? What do we assume is broken? We assume the light bulb. Absolutely, you were right. You win the prize. But what about the switch? We forget about the switch. The switch is in the hypothalamus. And these are chemicals that damage the switch. So when you do your challenge tests, obviously you're going to have normal response because the pituitary is not damaged, but the actuator to allow the pituitary to produce and release the hormone is. So when we do these bogus challenge tests, of course, you're going to get a positive response, and therefore you don't need growth hormone. So this is the short version. It's an incredible thing. Absolutely incredible, and they have it very well defined now. This started in 1999. So we know head trauma can lead to specific hormones or chemical production that leads to specific damage to specific areas of the brain, apoptotic. And those are the key issues, cap space 3, cap space 1, BID. It actually has chemicals to turn off the mitochondrial function in the classical apoptotic pathway. There's a chemical that's being looked at, which is called S100B, which is only valid in the blood for 48 hours after a traumatic brain injury. So we can do a blood test, and the level of this serum S100B that is attained is relative to the amount of damage in the brain. And you can do an MRI, CT scan, and not see anything physically damaged because it's on a cellular level. Neuroendocrinology, this is a neat area. These are some of this is out of a new book that I'm writing on the subject, traumatic brain injury, diagnosis and treatment, clinical approach to diagnosis and treatment. These are the technologies that we have right now. Most of us know many of these protocols. DTI, MRI is relatively new. Fusion imaging is new. And this is a classical CT scan of the brain. You can see that there's been expansion of the ventricles with loss of cerebral matter. In a study that was done looking at the first 100 non-combatants, we're able to, with a 1.5 or a 3.0 test list, so if you send patients out to have studies done to look at damage post-traumatically or someone fresh or old, you want to make sure that the Tesla of the MRI that you're sending them to is at least a 1.5 or a 3.0. If it's anything less than that and you don't get the resolution and find these unique issues. In 100 people, 76% of them had MRI findings. And you can see that 59% of them happen in the hippocampus. The hippocampus is memory, recall, the ability to learn new things. Septum pellucidum, dilated periventricular spaces, diffuse axonal DAI, which is extremely important, gray matter to white matter. It's the interruption of the pathways, like what happens in Alzheimer's, and what we're now looking at or knowing happens in traumatic brain injury. So you're losing communication between one area, so integration of visual, auditory, your external sensors are diminished in how you respond to it. In 29%, if you look at the next to the bottom, only pituitary is 14%. And we focus in on the pituitary. It's not the main area. This is gorgeous. I just had this done on myself. Diffusion tension MRI. The physics are 6 books to understand how this thing works. But it's a basic MRI, and then what they do is they tweak the angle of the MRI, the magnetic field, and it throws off another electron, which they get the color. These are the tracks in the brain showing the communication. Isn't that beautiful? And we can get it down to looking at areas that are torn. So we can see interruptions of pathways. So it's no longer an issue, the guy got hit on the head, and he can't talk. But now you can see that there's a interruption in that area Brocaw, or the parietal to the temporal lobe, or from corpus callosum to whatever, cerebellum. We can now pick it up and see it as holes. Clinical course, TBI, and any brain function can be disrupted with TBI. Impaired memory, faulty judgment, depression. I don't have to have head trauma to have that. Irritability, emotional outbursts, disturbed sleep, diminished libido. These are all hormonal. You can relate them back to the hormones that those of you who deal with hormonal endocrinology can see the relationship. And what we found is that in traumatic brain injury that there's a progression of the hormones that are lost. You don't have to have 100% of all hormones being lost, but what we find is growth hormone, then the gonadotropins, then the thyrotropins, and the corticotropins. I had head trauma at 4 and 17. It didn't hit me until I was 34 with a subsequent other issues. And I had growth hormone, testosterone, and thyroid deficiency. 35 to 40% of TBI patients have some form of hypopituitaryism. In a meta-analysis of some 128 articles, they found from 40 to 90% of the people had one or multiple hormone deficiencies after a mild traumatic brain injury. Mild traumatic brain injury, if you remember your Glasgow, is 12 or higher, 15 being, perfect, 12, 15 normal, then 14, 13, and so forth. So you don't have to have a major impact. You don't have to have loss of consciousness, as I'll tell you in a case a little bit later. Hypopituitarism, transitional phase. Children who are prepubescent, who have head trauma from roller skating, bicycling, skiing, whatever the situation, just getting whacked upside the head for being kids. What happens is it's extremely important that we assess them from a hormonal standpoint, because they'll lose altitude, they'll lose cognition, they'll lose all those factors of a good or better personality. But, when they're 18, all that doesn't, you know what I mean. This is an incredible article where they looked at, within the first 3 months, people who had mild head trauma. And they found that in 3 months, 56% of them had one or multiple hormone deficiencies. And then at 12 months, there was 36%. There's only one hormone that increased, which was growth hormone. It continues to diminish in its amount of people who have growth hormone deficiency, which is very important, because what we're finding in the neurological literature is that growth hormone is responsible for regeneration of microtubules, of the neurolemma, of the tau protein. So if you tau protein, those people know the physiology of in Alzheimer's, tau protein is a major portion of it. You can rebuild the microtubules with growth hormone. Prevalence of hypopituitarism. In terms of severe trauma and deficiency, gonadotropin 17, there are hundreds of articles that give their own take on percentage. That's why the meta-analysis of 128 is probably the best one, which I don't have here. 30-year follow-up. So what's the significance on Axis 1? 30-year prospective study of people who had mild head trauma found Axis 1 major depression in 26.7%, alcohol abuse, substance abuse, panic disorders, phobias, and paranoias. So the people that we see in our practice that have depression, and we put them on antidepressants and never check their hormones, we're doing a great disservice. I have a number of people who are testosterone deficient. You replace testosterone, they don't need their antidepressants. Brain trauma and hypopituitarism, these are just a little bit repetitive. Because of time, I'll move on. The impact of TBI on central hormone production. This is a gentleman, the case that we just won, of 56-year-old who had a traumatic brain injury. He had an 8,000-pound metal plate graze his head, knock him to the ground, had his laceration, 12 sutures, ends up having the next day some beginnings of personality change. For 3 years, his personality changed, went to a neuropsychologist, psychiatrist, was on antidepressants, and in 3 years to almost the day has a heart attack. His attorney calls and says, "Is there any relationship between head trauma and heart attack?" And I said, "Absolutely." So the guy came, and the doctor that had seen him in Arkansas was a disciple of one of our courses, and saw it, put it together, did absolutely the right testing, and we saw him. The endocrinologist on the other side, when he got our report, said, "Treat him." I said, "Wait a second, you're on the other side. You're supposed to be telling us that we're full of it." He says, "No, treat him." The cardiologist said, with all due respect, Southern boy, he said, "Your report is so full of it, he can smell it from California." I said, "Thank you," and that was June, July of last year. Well, in September, October, the American Association of Clinical Endocrinologists published their 2009 paper on growth hormone, which their last one was 2003, and they made 2 major changes. Number one was growth hormone drops when you have head trauma, and when you have low growth hormone, there are increase of 9 risk factors for heart disease and heart attack. So sent them that paper and a cover letter. In January, they came and settled for $2.1 million. Growth hormone, benefits of growth hormone. This is that 2009 article. And it's very well done, because they go through hundreds of articles looking at a whole gamut of areas, growth hormone and diabetes, using 0.1 milligram of growth hormone to help with people who have insulin resistance. Beginning to end cardiovascular. This is one of the articles that talks about all the abnormalities that happen when you're growth hormone deficient. and the acceleration of heart disease. Neuroendocrine dysfunction in patients recovering from traumatic, 15% may compound the physical and psychological complications of traumatic brain injury and interfere with rehabilitation, basically stating that you need to replace the hormones in order for the person to get better. If you put them in front of Wi-Fi and you have them twiddle their fingers, they'll have some improvement, but they're not going to get better. Gonadotropic hormones. The benefits of progesterone, testosterone, and estradiol prevents neuronal loss. There's doctors Dr. Pike out of USC wrote 278 articles about androgens. You can go on Google and get them. Use Google Scholar, not just general Google, where he talks about the benefits in dendrite regeneration and regeneration of neurons with androgens, specifically testosterone. It's a testosterone becoming the DHT, going to 3-alpha-androstenedione, and then adenyl cyclase. It helps with repair. And as I said earlier, the benefits about progesterone, it's progesterone as alloprogesterone. Pregnenolone, they find that people with low pregnenolone have social phobias, so you don't have to take this, Paxil, which was being promoted for social phobia. Take Paxil. Well, check the pregnenolone, their testosterone, replace that. General anxiety disorder, hormone deficiency. Neurosteroids in the hippocampus and neuroplasticity, memory, the ability to learn new things. Pregnenolone, estrogen, progesterone, no longer just reproductive hormones, deals with mental functionings, brain functionings, blood flow, protection of the brain. Estradiol increases the microglia, which are the white blood cells of the brain, so it helps survey for any kind of contamination. That's the estradiol in the immune system. Cognitive functioning. Andropause is androgen replacement therapy indicated for aging males. Well, you read these: mood, depression, inability to function, muscle mass loss, wasting, frailty, osteopenia, falls, and so forth. If you have someone with head trauma who loses their testosterone, you've got a setup for all these problems. Depression, male, now we know in females, in a male who is depressed on antidepressants and not getting better, check their testosterone. Replace their testosterone, they get better. The ideal thing to do is not put them on the antidepressant, but to check them out thoroughly from the hormonal standpoint, make sure they're not testosterone deficient. Another article on the same, dysthymia, low testosterone, cognitive changes. Multiple sclerosis. I have 3 patients who with multiple sclerosis. One is a gal with 25 years with multiple sclerosis. A year before she came in, she was totally disabled. Within 3 days of starting on her hormone replacement, based upon her laboratory tests showing the deficiencies and insufficiencies, she started getting better. She's now 6 years without an attack. And it's all in the literature. I mean, these are just one article representative of the area. There are hundreds of articles. Anorexia nervosa, again, relative to the depressive component of it. Women with anorexia nervosa who are failing treatment, check their testosterone, put them on testosterone. What I'm saying is head trauma creates or helps to support a lot of illnesses, and if we ignore the hormones in people who are with head trauma, and some of the head trauma cases you'll never recognize because they happen when the child was a baby and fell out of the crib. They don't remember falling out of the crib, and also a component of head trauma is retrograde amnesia. So, I think I hit my head, but I don't remember. Emotional intimacy, this is female sexual dysfunction and hormonal deficiency, whether or not precipitated by head trauma or just low hormones. Quality of life is the underlying issue. Benefits of hormone correction, age-sensitive cognitive functioning, you improve cognition, you improve upon their emotional status. Perioperative growth hormone treatment, people who went in for abdominal surgery when they were on hormone correction, where their hormones were corrected, they responded a lot faster. Study out of Harvard, out of Brigham Women's Hospital with children with burns, those that were corrected on their growth hormone level accelerated in their healing and were out of the hospital in 25% less time. Gamma interferon, growth hormone directly, Karolinska Institute in Stockholm, Sweden. They found that white blood cells are positively affected by adequate physiological levels of growth hormone. The gamma interferon goes up. I used to get sick 2 to 5 weeks out of a year. I've been sick 3 days in 12 years. And the patients in their questionnaire that they get, as they're in their program in the office, they're asked about their allergies, about their infections, and they find 3 months, 6 months that their duration of their illnesses are less. If they get sick, it's less frequent during the year. They recover a lot faster. The average duration, this deals with respiratory failure and respirator-dependent postoperative cases, where after 38 days of growth hormone replacement, 81% of previously unweanable patients were able to get off mechanical ventilation with a 76% survival rate. They wouldn't have survived if they didn't have the replacement. If you think of it, people with COPD, that they're breathing at a rate which leads to atrophy of the respiratory muscles. And we know that testosterone helps to rebuild muscles. Growth hormone and testosterone together are best at replenishing the muscles. And we have people with COPD with their little green tanks behind them that no longer are carrying their little green puppies. They get better. Dr. David Clemens from University of North Carolina, head of endocrinology, did a study where he gave them growth hormone, and they improved 10 millimeters of mercury in 6 months. 10 millimeters of mercury, which is a significant amount. David L. Clemens, very active in trying to define the best ways to diagnose growth hormone deficiency. Growth hormone lowers cardiovascular risk. We talked about that. This is an older article, an 18-month study. It dropped C-reactive protein, interleukin-6, and serum amyloid peptide A, and the plaque test, or lipoprotein a, serum cholesterol, and LDL. Also, it's been found to drop homocysteine, which directly damages the endothelial lining. Harvard study improves the cartilage and bone in joints. We have patients, there's a Dr. David R. Dunn in, Alan R. Dunn in Miami, Florida, who does intra-articular injections of growth hormone and has cartilage regenerate in 18 months of about 5 millimeters. Body composition, metabolic fuel, this is an important one. Between 12 midnight and 7 a.m. is when we cannibalize our body fat, structural fat, for fuel while we're sleeping. And we know that by a byproduct called non-esterified free fatty acid. And in the cases where people were deficient in growth hormone, the non-esterified free fatty acids were very low. And when you put them on growth hormone, they popped up. And that meant that mobilization of body fat for fuel. Recovery. Hormonal replacement in patients with brain injury, hypopituitarism, who, what, when, and how to treat. Well, there are 3 phases: acute, recovery, and chronic. As I showed you in the earlier article, the 1 year study, 56% at 3 months had hormonal deficiency and 36% at 1 year. What about these 36%? Well, although post-traumatic cranial diabetes insipidus is known to recover almost 100%, the anterior pituitary hormone deficiencies, when they're established, that means at probably 12 months, it's a very rare event that they recover. So the recommendations, articles are still coming out, hundreds of them per week, and with the military issues, even more. It's to recognize that there was a traumatic brain injury, incorporate into your initial questionnaires for the patient whether or not there's ever been any kind of head trauma. Now, most people think head trauma is being dropped from the 12th story onto their head. They don't think of the rear end. There was a case in California where award was $1.24 million for a guy who was rear-ended at 5 to 7 miles an hour. But he developed traumatic brain injury. It was the whiplash that happens. Our chiropractors here probably see more whiplash than we physicians, and you need to incorporate into your questionnaire about traumatic brain and start looking for these parameters of deficiency or deficits in functioning. Early hormone supplementation can help to minimize the psychological and also physiological impact of traumatic brain injury. The new AACE guidelines for growth hormone suggest waiting 12 months. This makes absolutely no sense. Absolutely no sense. You see the person month, 2 months after their head trauma, And you find that their growth hormone level, which should be 250 to 350, is 74. It's a real case, 74. So according to the AACE guidelines, they're saying wait 12 months to see if they get better. Well, if they don't get better based on the statistics that I showed you, then you're supposed to treat, which means you're up to a year behind the ball, and you've lost the benefit of helping them to regenerate neurons, to reestablish. What I'm finding in my practice, people who are less than 6 months post-traumatic, they recover in 6 months. People who are beyond a year can take a year to 2. This guy, 3 years, he's now a year into it, and he's about 30% better based upon his intake sheets. So the further away you are from the damage, from the injury, for the hormonal deficiency, the longer it takes. So this makes absolutely no sense, in my guesstimation. Since hormone deficiencies and insufficiencies can start immediately, get the labs as soon as you see them and identify them as being a candidate for traumatic brain injury. Do not use the degree of damage or injury or presence or lack of loss of consciousness as a guideline whether or not to proceed as a traumatic brain injury. Any kind, even just a sudden slip and jerk or being hit at 5 to 7 miles or stopping short and throwing forward and back is enough to precipitate this. Going to amusement park rides. You have children who are a little bit off, you might want to go and check where they're socially inept or there's a higher degree of depression. There was a adolescent physician who reported on his population. He did not understand why the group between, I think it was 12 and 20, why so many of them had hormonal deficiency when they tested them. He went to their perinatal, neonatal records, and he went through all the records of those that he could, and he found that every single one of them had one form or another of a traumatic brain injury, whether or not it was a cord around the neck, whether or not it was a vacuum extraction or a high forceps extraction or inversion rotation or all those things you gynecologists, OBs do. But it was enough for seeing, cone heads because of the failure to progress and the pressure on the cranium. These are significant enough to create the scenario leading up to the future hormonal deficiency. So don't blind yourself on, well, it wasn't significant enough. How do you know? The only way to know is to check. On new cases, CT scan followed by an MRI, then the DT MRI. That's that beautiful colored thing that we saw. There's a new one which is called a fusion, where it takes a SPECT scan. The SPECT scan looks at the integrity of either a chemical marker or blood flow, and it should be nice and homogeneous. And when there's a deficiency because of a deficit, because of a deficiency or a blood flow or a damage, you'll get little holes in it. Now what they're doing is they're taking the SPECT scan and the DTR and they're overlaying them. So you see a solid structure, transparent solid, semi-solid structure with the neurons, the nerves. And now you can actually see, let's say if there was a tumor, you can see within the tumor and see how the nerves pathways go through it, so that when a surgeon goes to do his work, he more specifically can isolate and avoid damaging these nerves, where in the past you had a solid block of tumor, you didn't know what nerves were going through it, and you just cut it out, not knowing what you were taking from that patient. Now we can see it. And GE just came out with a new piece of equipment, which is a very focal MRI, very small, and you can work within the room, obviously not wearing any metal. And during surgery, you can get guided by this MRI technology. I'm going to Germany on Monday to see the equipment. Psychobehavior and cognitive testing to monitor treatment improvement. You always want to monitor the psychology of the individual, because a lot of the parameters that you'll find relative to, say, testosterone deficiency will show up very clearly in a personality assessment. Neuroendocrine dysfunction after TBI is underdiagnosed, undertreated, and affects everybody and the rate of recovery. Single or multiple pituitary hormone disruption occurs in up to 2/3 of persons with, or people with TBI, most commonly affecting the gonadotropic and growth hormone axis, which the federal government did a study in '93 under Mark Blackman and Mitch Harmon, and showed the synergy of these two hormones together are incredible with body fat, VO2, cardiovascular, cholesterol, just a whole litany of positive, by having it normal, positive effects on the body. So if we don't check, the quality of life goes straight down. TBI Med Legal, you can go and look at that website, and there's a whole bunch of articles to start you on your process of knowledge. You can download all the stuff that you want. There's 100-some-odd articles, which were put in a very progressive manner so that you can start at the beginning and get, as the articles go on, they're a little bit more intense. Okay? Thank you.